Bismillah, Assalamualaikum and hello everyone. My name is Ahmad Daniel bin Amir Rizam. So today we are going to discuss our topic, which is nursing care of client undergoing surgery. We will focus on 4 pre-operative. Let's get started. So in this video we will look at on introduction for pre-operative nursing care and lastly conclusion. Started with introduction. The pre-operative phase is crucial in preparing patients for surgery, minimizing anxiety, and ensuring they are in optimal condition for the procedure. As nurses, our role includes assessment, education, and planning to address potential complications and promote a smooth transition to surgery. Okay, basically what we learned in class about nursing care, we need to have nursing diagnosis, objective, nursing interventions, and evaluation. Our first nursing diagnosis of pre-operative is ineffective coping related to fear of surgery, as evidenced by verbalization of anxiety and sleep disturbance. For objective, we have to make sure the patient will demonstrate effective coping strategies within 48 hours. For nursing intervention, what can we do as nurse to support our patient? We need to assess the patient's level of stress and coping mechanism to identify the patient's emotional state and coping abilities. Next, provide a supportive and non-judgmental environment to encourage open communication and emotional expression. Third one, teach relaxation techniques such as deep breathing and to help the patient manage pre-operative anxiety. Moreover, encourage family or caregiver support to provide emotional reassurance and reduce feelings of isolation. Offer pre-operative education to reduce uncertainty to enhance the patient's understanding and alleviate fear. Refer to counseling service if needed to provide a professional psychological support when necessary. Last one, encourage verbalization of fears and concerns to allow the patient to express emotions and receive appropriate reassurance. For evaluation, patient demonstrate effective coping strategies within 48 hours. Another common issue is lack of knowledge about the surgical procedure. Our second nursing diagnosis is deficient knowledge related to lack of exposure to surgical procedures and post-operative expectation, as evidenced by patient expressing misconception or asking repeated questions. For objective, as nurse, we have to make sure patient will show understanding of the surgical procedure, pre-operative preparation, and post-operative expectation within 24 hours. Nursing interventions. For the first one, educate the patient and family about pre-operative instructions, procedure, and expected outcomes to empower the patient to actively participate in their care. Besides that, use visual aids or written materials for better understanding to accommodate different learning styles and enhance comprehension. Moreover, assess patient's comprehension through teach-back methods to ensure the patient accurately understands the information provided. Next, explain post-operative care including pain management and mobility expectation to help the patient prepare mentally and physically for recovery. Clarify misconceptions or myths about surgery to reduce unnecessary fears or promote accurate understanding. Demonstrate and practice deep breathing and coughing exercise to prepare the patient for effective airway management post-operatively. Last one, provide contact information for further questions before surgery to ensure the patient has access to resources for additional clarification. For evaluation, patients show understanding of the surgical procedure, pre-operative preparation, and post-operative expectation within 24 hours. Proper nutrition is essential for healing and recovery, but pre-operative fasting can sometimes pose a challenge. Our third nursing diagnosis is risk for imbalanced nutrition, which is less than body requirements related to pre-operative fasting. Our objective is patient will maintain adequate nutritional status within 72 hours. How can we manage the patient? First, assess the patient nutritional status and dietary intake before fasting to establish a baseline and identify nutritional deficiencies. Besides that, monitor for signs of malnutrition such as weight loss, weakness, and poor wound healing to detect early nutritional deficiencies that may impact recovery. Moreover, Collaborate with a dietitian for individualized nutritional planning to ensure adequate dietary intake based on patient needs. Ensure adherence to pre-operative fasting guidelines while minimizing prolonged fasting to reduce the risk of aspiration while preventing excessive nutritional depletion. Next, encourage hydration before the fasting period begins to prevent dehydration and electrolyte imbalance. Last one, monitor blood glucose levels in patients with diabetes to prevent hypo or hyperglycemia due to altered dietary intake. For evaluation, patient maintain adequate nutritional status within 72 hours. Okay, maintaining skin integrity is another critical pre-operative concern. Our last nursing diagnosis is risk for impaired skin integrity related to pre-operative skin preparation and prolonged immobility during surgery. The objective, patient will maintain intact skin integrity within 48 hours. On nursing interventions, the first one, encourage proper hygiene including pre-operative skin cleansing with antiseptic solutions to reduce microbial load and minimize the risk of surgical site infections. Besides that, ensure removal of hair at the surgical site as per protocol to prevent skin abrasions and reduce bacterial contamination. Next, assess the skin for any pre-existing wounds, rash or infection to identify potential risks and notify the surgical team for preventive measures. Moreover, apply protective barriers such as skin prep solutions or padding for bony prominence to reduce friction, shear and pressure injuries during surgery. Number 5. Educate the patient on the importance of avoiding lotions or powders before surgery to prevent residue that may interfere with surgical adhesive or antiseptics. Encourage repositioning and range of motion exercise before surgery to maintain skin integrity and circulation before prolonged immobility. Last intervention, monitor for allergic reaction to preoperative antiseptic solutions to prevent skin irritation or hypersensitivity reaction before surgery. Evaluation, patient maintain intact skin integrity within 48 hours. So in summary, pre-operative nursing care is essential in ensuring a safe and successful surgical experience. By addressing anxiety, educating the patient and minimizing risk, nurses help optimize the patient's physical and emotional well-being before surgery. A well-prepared patient contributes to improved surgical outcomes and smoother recovery process. That's all, and thank you for your attention. I hope this video has given you valuable insights into the critical role of pre-operative nursing care. If you have any questions, feel free to ask. Bye bye. Assalamualaikum.